I am Edina Bilic Komarica from Sarajevo, from Bosnia and Herzegovina, and I am working in the University Clinical Center Medical of Sarajevo. My presentation is preoperative risk factors and the corrective medications there for the success of the operations and the reduction of postoperative complications in middle-aged and senior patients. Introduction. The population is aging. This is because better medical care and the living conduction have allowed the people to reach and older age in the better health. As the elderly, I'm sorry. Just a moment, sorry, technical. The population is, again, this is because better medical care and living conditions have allowed the people to reach and older age and the better health that previously possibly. As the elderly have continued to grow in number, so has the number of the surgical procedure performed in the segment of the populations. Outcome study demonstrated that morbidity and the mortality are increases following surgery in the elderly as compared to the younger populations. Among the many factors contributing to increased surgical morbidity and mortality, perioperative complications are directly related to poor outcome in the elderly. In addition, perioperative complications in the elderly are associated with a greater mortality. Preoperative preparation of patients for surgery interventions. This is a little digress. I think it's a very important preoperation of patients for surgery interventions. And this is a presentation about it. Once the diagnosis and the indications are made for the operations, next is start with the preoperative preparations of patients. Timely and professional preparations shortens facilities surgery times as as postoperative period. It lasts shorter or for a longer period of time, depending on the type and the scope of the operations and the health status patients. Upon admission to the hospital, the patient receives a preoperative questionnaire, which fills and gives individual medical documentations. The questionnaire, including previous operations, anesthesia, allergic to drugs, the regular therapy it takes. In addition, patients received all informations related to the surgical interventions, and after that he signs and gives his consent for surgery anesthesia. I'm sorry, I have just a moment. Technical problem. Just a moment, I'm sorry. I'm sorry. After that, he signs and gives his consent for surgery, anesthesia, and blood transfusion in the case needs. Parents are signing for underage and children. In modern and development countries, a preoperative questionnaire is sent before admission to hospital by mail, by fax, or by post, so on anesthesiologist is in the position to inspect the documentation or asking for possible additional findings. In our condition, anesthesiologists most commonly the day before the operation visit the patients. She becomes aware of the health condition and gets acquainted with the documentation, and after the examination it gives consent for anesthesia. Preoperative preparation consists of several components: physical, clinical, laboratory, medicamentous, physical, sanitary, immediate premedications. After the establishment, diagnosis, and the indications for surgery, the patient is completely understandably worried. On the one hand, there is a concern about the operations itself. However, there is a special concern about pain, anesthesia result, and outcome surgery, but also the quality of life after surgery. Physical preparation would start from the first meeting with the surgeon. After the indicated for surgery, it is ideal if there is a physiologic service in the institution who are already at the reception. Establishes contact with the patients he is acquainted with the health state, concerns and problems of the patients on with his physiologic state. The most common reason for patients dissatisfaction is poor communications and insufficient information. It is desirable to prepare a psychological questionnaire for the patients on the basis of whom we can find out about a more realistic assessment of the state and intensity of the stress that the patients has. It is very important the contact of the patients with the staff, which gives confidence in the expertise and knowledge. Details explanation of the operation procedure and the following procedure preoperative and postoperative. If during surgery, anesthesia, amputations, a certain part of the body, finger, leg, breast, the physical preparation is of great and special significance. It is therefore assured during the first meeting that the patient has a large number of visits and concerns. So this is ideal of during preoperative preparation. There is a possibility of a new one meeting the physiologist. Physiologists continue to cooperate with the patients and after surgery during the hospital stay. Clinical, it's administered to all patients and including additional clinical indicators. Patients' health conditions necessary are next. An overview of the internist ICG, RTG line, and the thyroid gland and the RTG trachea. Supplementary diagnostic procedures for heart examination, echo. Double blood vessel, Holter, Rang, spirometry, blood gas analysis, supplementary test, kidney, liver, endocrinologist or overview, and the shield operations gland. If you need of echo, abdominal, CT, abdominal, and pelvis chest. Each patient is subjected to laboratory analysis before the surgery to getting insight into health. The patient comes to institution with finished the results of laboratory analysis. They should be 2 months old. Controls, sedimentations, biochemistry, glycemia, electrolyte, urea, creatinine, hepatogram, urine examination, hematostasis, bleeding time, coagulations, INR. Blood group and the interaction are mandatory. If surgery is done on the thyroid gland finding, and the thyroid hormone is also needed. It relates to medications that are regularly taken by the patients for chronic illness which heals. Contemporary anesthesia implies adjustment of the anesthesia to the patients, not patients to anesthesia. Treatment of some chronic disaster which the patient has regulations of sugar, glucose, and the patients with diabetes, pressure regulations, in people with high blood pressure, weight regulations, and OBS, reduction diet, and the dates, treatment, and the eventual infections. And the most important thing is that the patient does not interpret her own regular therapy, except when it is on oral antidiabetic and anticoagulant drugs, usually after some cardiovascular operation. In these cases, the patient is admitted to the hospital and switched according to the finding of laboratory analysis and venous medications giving. Ideally, the smoker would stop smoking 2 weeks before surgery. If necessary, laboratory conditions are corrected in hospital conditions before surgery, blood supplementation in anemia and electrolyte according to findings. The patient is given the medications fluoxetine and the night before surgery as a prevention of deep vein thrombosis for larger and larger surgery at increased risk, or if the patient has pronounced and enlarged veins. It is desirable that the patients should drink a sedative before surgery, to do anything to calmly spend to the night before the surgery. Operation of the operation field is done the day before the operations. Shaving takes place, bathing, dressing, and the clean personal lingerie. Depending on the type of surgery, for additional purification of the intestine by various means is made during the preparation of patients with intestinal surgery. In the morning, on the day of the operations, does not drink, does not smoke, does not eat, but take his regular therapy early. In the morning, a couple of sips of water. On day of surgery, the patient is without lipstick, without nail, without jewelry. It is good and practical to remind the patient a few times about that she does not eat and drink before surgery, usually from midnight. On the day of the operation, it's removed articles, prosthesis. The patient is changing in the clean clothes, and of surgery requires an urinary catheter or a nasogastric probe will be placed. With complete documentations accompanied by a nurse, patients goes to the operations block, where patient's identification is performance checks, the diagnosis and type of surgery, and performance premedication. It aims at the calm patients, prevent increased salvations of the cell, and prepare is for anesthesia. A safe intravenous line opens Missouri body weight because medicine and anesthetics are doses by weight. Premedication is given 30 minutes before surgery, and the goal is to achieve the strongest effect when the patient's entry into the operation room. Preoperative preparation and examination of the patient's general health type and the extent of surgical interventions give an anesthesiologist and the chance to make a work plan. Select the most optimal type of anesthesia, general, regional, combined. Minimize complications and contribute maximum safety and patient's satisfaction. It's very important that the patient is familiar with the method of preparations for surgery, basic procedures, anesthesia, control during and after surgery, and possible complications. Preoperative preparation starts with talk between doctor and the patients. The patients bring decision on surgery correspondent of the term of operations and gets its all necessary date necessary for quality preoperative preparations. Depending on the type of surgery, the patients receive instructions on what it is a need, such as the laboratory and diagnosis such that must be done before shuttle surgery, which must not be older than 30 days. The patient completes the questionnaire before anesthesia, in which she reads data on the current states of health, possibly allergy and drugs. On the basis days, the doctor anesthesiologist makes a decision about possibly addition, specialist examination, as well as diagnostic or laboratory tests. Before receiving patients in the hospital, anesthesiologists consider preparing anesthetic examination based on the patient's state of the health, laboratory, and other findings. He also meets his patients with the types of anesthesia, their possible risk. Choosing the optimal way of anesthesia is confirmed by the patient's decision. Anesthesia. The main goal of anesthetic procedures is to remove the pain and the discomfort that they can case curtain, diagnostic and therapeutic procedure, which is achieved using different methods of anesthesia and using modern anesthesia equipment that private insight into the work of the all vital organs. The right created optimal condition for the work of the surgeon and significantly reduce the risk of anesthesia. The two basic groups of anesthesia are general and regional or local. General type of anesthesia that brings the body into a sleep state and which patients does not feel the pain of any other external stimulus. It is called general anesthesia. General anesthesia begins with the introduction of intravenous cannula and fast-acting sleeping medicine, and continues to be given by strong once analgesics and other necessary medicines or anesthetic. This situation is magnitude during and the inter-operation. Additional aids for the patients is on the oxygen supply and anesthetic cases are anesthesiologist mask that is placed over the nose the mouth. Laryngeal mask, which is placed before the entrance to the trachea, or a tube that is introduced into the trachea itself. Anesthesia is interrupted after surgery and patients wake up. The patient is placed in the waking room, and the supervision upon the expert staff. And according to the assignment of anesthesiologists, that is after the establishment stable vital functions and the used analgesic therapy returns to his sick room in the department. Local anesthesia is type of anesthesia in which local anesthetic are given directly into the operations field or the victim of the nerves that inspire the area. This way remove the pain sensation and avoids giving the others drugs in the bloodstream and their possible effect on the functions of the whole organism. The organism is during the operation in the local anesthesia in the wake. Patient in local anesthesia can get a mild sedation to fall in the sleep if it does not want to see or hear what's happening in the operating room. This type of anesthesia is particularly recommended for elderly patients, pulmonary and cardiac patients. Advantages of this type of anesthesia are numerous. Nausea occurs extremely rarely, so these patients soon after completing surgery can start to eat and drink. Patients with their behavior can significantly contribute to safer cures, surgery, and postoperative recovery. Before the surgery, they cannot eat nothing and last 6 hours before the operations. They must not enter and liquid before. It is recommended not to smoke 1 or 2 hours before the procedure. Drugs that were taken at home for a while before hospitalization is taken in agreement with the anesthesiologist that is on duty. Doctors usually do not interpret day-to-day therapies and the required adapts to patient's current state. He recommends his medications in bringing the original packing to the hospital. These instructions apply equally to the general and regional local types of anesthesia. Result: the average age of patients was 65.5 years, men being in majority. 64.7% patients were operated for cancer, 47%, and 27.53 for benign tumors. A majority of patients had 2 or more risk factors identified: hypertension, 16%, cardiovascular, 45.2%, 25.4%, frequency freezing, 25.4%, 46, 19% patients required corrections of the internist therapy, applied heat road, or the introduction of new drugs. Postoperative complications during hospitalization occurred in the 3 patients, namely lung embolism and deteriorating hypertension. No fatality occurred in the examination group during hospitalization. This is our hospital. Conclusion: based on the current literature of loud and medium quality, it is not possible to comprehensively quantify risk factors for complications. Nevertheless, older age are associated with increased postoperative complications. Future research should aim at prospective data collections, reporting of outcomes, and the uniformity of deficiency. In conclusion, elderly patients representative and a significant portion of the patients the anesthesiologists are currently taking care of and will be in the future. Preoperative internist preoperations of both middle-aged and senior patients reduce the incidence of postoperative complications. Thank you for attention. I hope so that we see soon another conference.